So what does your heart do? Anybody know what your heart does? You. Yeah, you. What's your name? Jack. I've never heard that name before, but I will call you Jack. So Jack, what does your heart do? Do what? That's right. It pumps blood. So your blood goes round and round, right? So when your heart has problems, the blood that normally your heart would pump, you know, it's like a pump. When the heart stops pumping, what do you think happens? Yeah, that happens, right? But you try to make that not happen. But before that, what happens is sometimes parts of your body, they don't get enough blood. When you don't get enough blood, there's all kinds of things that happen. One thing is you can have a heart attack. So you're sick. You know what that is? Yeah. Right. Usually people have to go to the hospital because their heart hurts. Sometimes they feel like they say an elephant is sitting on their chest because it can't breathe and it hurts a lot. And then depending on how serious it is, many times they have to have surgery, things to kind of fix their heart so their heart becomes better again. And then they have to take medicines. Doctors give lots of medicines, right? So a lot of times those people have to take medicines too. Yeah. Can be cured? Yeah, you bet. Can be cured. Yeah, most of the time it's cured. So when somebody goes to the hospital with pain in their chest and the doctor says, I think you're having a heart attack, there's lots of things that we can do to help to make it better and fix it. Nowadays they can put little things in the arteries and in your heart. You know what an artery is? Yeah. The blood tube that they go all over the place. They have little, they're called stents. They're like little things that open up the blood vessels and make it blood up. Okay, start going here. Say it again. Yeah. Arteries are the ones that go from your heart out to your body. And then the veins, the purple ones, you know, that you can see in your skin sometimes. The purple ones are the tubes that bring blood from out here back to your heart. So there's two types. The red ones go out, the purple ones and the blue ones go in. Round and round. Blood goes round and round. Okay? So that's heart attack. The heart's important. If you don't have a heart, you're not going to live very long. You need a heart, right? It needs to pump right. So what do you guys know anything about how to keep your heart healthy? Don't smoke. You said don't smoke, right? Or did you say smoke? Don't smoke. That's right. Don't smoke. It's a big difference there. No smoking. Smoking's bad for your heart. Exercise. That's right. Guess how many times doctors say you should exercise in a week? That's the best for you. Eat vegetables. That's right. Exercise 5 to 7 times a week. That's a lot. What do you think? It's hard. It's a lot of exercise, but it's good for your heart. It keeps you healthy. So exercise, eat vegetables, no smoking. Anybody else have any thoughts? Don't drink alcohol? That's true. Yeah, don't drink alcohol or drugs. That's good to all kinds of things. How about food? Should eat fruits? Yes. Fruits, lots of good fruit here. Checkups, regular checkups, that's important too, especially when you get to be older. So that's your heart, okay? Any questions before we move on? First you, what's your name? What causes it? Heart attack is caused by when one of the arteries, you learned about arteries, right? Arteries go from your heart out to your body. There are arteries that go to your heart too, because every part of your body needs blood. So when those arteries that go to your heart, if they get plugged, they can get plugged with cholesterol, they can get plugged with other things too. When they get plugged, your heart doesn't get enough blood, and that's what causes heart. lot of things can cause it. The most common though is when they get plugged with kind of like cholesterol. So the things that you said were bad, like smoking, no exercise, if you don't eat fruits, if you get big, yeah, too much fat, too much cholesterol in your body, and that can make the arteries plug up. What happens? A lot of times nothing really happens because you can't tell that it's high until you go to the doctor and you measure. But if your blood pressure is high for a long time, it can be bad for your heart. Okay, you ready? You ready with that question? Okay, let's go. Good question. If your heart's not pumping right, and if your heart kind of stops pumping, and then the blood stops flowing, then your circulatory system stops working. So usually people get faint, they can get chest pain, they can get problems breathing. Good question, guys. All right, let's move on. Low blood pressure? Depends on how low it is. If it's really low, you have to go to the hospital. And stay in the hospital because the medicines they give you have to be going into your veins. Okay. All right, who's ready for diabetes? Okay, so who knows what diabetes is? A new person. All right, how about what's your name? Louder, I can't hear. Janie? Janie. Okay, Janie. What's diabetes? That's right. Too much sugar. Too much sugar in your blood. It may be in your blood. It may be in all parts of your body. So when you get diabetes, there's two types of diabetes. There's a type that little kids get. Type 1, yeah. Type 2. Type 2 is the most common kind that older people get. When people get too big. That's a nice way to say that. They get a little bit big when they don't exercise. A lot of the same things that we talked about before. If they don't eat good food, they don't eat fruits or vegetables, they eat too much. You know the word carbohydrate? Yeah. You guys do? Good, yeah. So what's carbohydrates? What's a carbohydrate? Yeah, go, right? Lots of rice. What else? Wheat, yeah, like bread. Yeah. Grains, some grains. What about? Right. Yeah. All that good stuff, right? That's lots of good stuff here. Those are all carbohydrates. Too much carbohydrates, way too much carbohydrates, you can get diabetes. Diabetes isn't very fun. Sometimes when you first get it, you don't know you have it. You don't feel bad. You feel normal. Maybe you're a little bit chubby or something. But then after a long time, after many years, diabetes starts causing problems with your body. When your blood sugar is too high, it causes problems with a few different organs. Anybody know which ones? But not so much. There's others that are. Yeah, there's no problem with your veins and arteries. You cause problems with cells. You cause problems with your heart. You cause problems with your kidneys. You know what your kidneys are? Yes. What size? You got two of them, right? You have two of them? Two kidneys? 1, 2. Okay. Yeah. Sometimes, after a long period of time, if the doctor doesn't give you medicines and you're older, sometimes you have problems with your memory. You can forget things. Most of my patients that have diabetes, they end up having to use medicines. Usually they first start with pills. They swallow pills. It helps bring their blood sugar down. They also try to lose weight, exercise more, eat a better diet, less carbohydrates, right? Sometimes, though, if the blood sugar is still high, they have to take Insulin shots. Yeah, maybe it hurts from that. You guys know about insulin? Really? Say it again. Right. Yeah. The insulin is like a vacuum in the cells. It takes the sugar from the blood and moves it into the cells so you can use it. It's like kind of like gas. Sugar's like gasoline for people. Glucose, that's right. That's right. So that's diabetes. That's kind of boring, huh? You guys have any questions about diabetes? Yep. Can it pass from one person to another? No. Infections can pass from one person or another. You guys know about any infections? Bad infections? Cold, that's very common, huh? Everybody gets the cold every year, probably. You probably get it every year, right? Huh? Hepatitis, yes, that's one too. What happens? If your body doesn't have enough sugar, what happens when the motorbike doesn't have enough gas? It stops, right? It doesn't run. That's what happens. Kind of the same thing happens when your body doesn't have enough sugar. If your sugar gets too low, first you don't feel well. You kind of slow down, kind of like the motorbike when it starts, right? Slow. People feel faint. They get kind of sweaty. They maybe forget where they are. Then if it gets too low, they pass out. They can't stay awake because it's just too hard. There's not enough fuel. They get dizzy. They get very dizzy. Sometimes they can have a seizure. You know what a seizure is? Seizure is when your brain kind of has like a, we could say like it's a kind of a lightning storm in your brain. When you eat too much sugar, if you eat too much sugar and your body, the insulin's not working, you can get really, really sick and have to go to the hospital and stay in the hospital for a number of days. That's probably the worst thing that can happen quickly. Maybe lots of medicines in the hospital, lots of IV medicines. It's difficult. Okay, guys, what about high cholesterol? Yeah, I talk to people about high cholesterol all the time. You sure you want to talk about this? High cholesterol is, you guys know what cholesterol is? It's kind of like fat. Yeah, it's fat in your body and your blood. Sometimes if your cholesterol gets too high, it can make problems with your arteries, right? They can get plugged up. And sometimes if people don't eat the right diet, you know, we have to give them medicines to help their cholesterol get low. But you can't tell that your cholesterol is high. You can't feel it. There's no symptoms. So you don't know. You don't know until you go to the doctor and they draw your blood. Then we know. What do you think about cholesterol? Any questions? Yes? Good question. Fruits don't have too much, actually. Fruits are good. Fruits have some sugar, but they don't have a lot of bad stuff. Yeah, things that have fat, bacon, meat, ham. That's good. That's good, isn't it? It's not good for you. But also, your body will make cholesterol. So if you eat a lot of one thing, like carbohydrates, bread, rice, you know, your body will then convert that into fat. You have too much fat, you have too much cholesterol. So your body also makes cholesterol. Even if you don't eat a lot of cholesterol, your body will still make a lot of cholesterol. So you just have to watch what you eat. All of these problems that doctors take care of, a lot of it always comes from how people live their lives and how people eat. So if they don't exercise, if they don't live healthy, if they don't get enough sleep, if they don't do their homework, right? If they don't, if they eat a poor diet and they don't get any exercise, they get overweight, then a lot of these things happen. Bad things happen to your heart. You can get diabetes, you can get high blood pressure, you can get high cholesterol. So treating those, it's pretty easy. It's kind of all the same, right? Eat good, exercise. All right, cholesterol. So the patients that I have that have high cholesterol, most of the time I say, Jack, you need to change your diet. You need to eat less rice. Eat more fruits, vegetables, and exercise every day. And then I tell them to come back and see me in a few months and we'll check your blood again. Then if it's still high, sometimes we have to use medicines, but not very often.
But for example, like we don't eat very much anymore and changing it because tweaking everything is not really good.
No, you have to eat a little bit of rice, that's right. Remember, you can do everything in moderation. A little bit of everything is okay, but a lot of one thing is not good. So if somebody just eats rice and meat, not good. They eat a little bit of rice, a little bit of meat, maybe a little more vegetables and fruits, that's good. So remember, it's important. Sometimes it can plug up your arteries. And the arteries go everywhere, so you can, they go to your brain. Sometimes if your arteries to your brain get plugged, you can have a stroke. You guys know about strokes? Yeah? I think that's on here. Why don't we talk about strokes?
Strokes are funny.
It's really bad. It's really bad, right? Yeah. Heart attack's more common, but both can happen. It's a good question. So strokes. When you have a stroke, one of those arteries, it can happen two different ways. One of the arteries that goes up to your brain, the most common is the one in your neck. You guys can you feel the ones in your neck? It's kind of like where your throat is, your trachea right here. If you feel to the side of it, don't push on both at the same time, just do one. You can kind of feel a pulse there, a little bit in here. So that's your carotid artery. So when that artery gets plugged too much, sometimes it can get plugged all the way, and then blood doesn't get up to one side of your brain, and you have a stroke. That's the most common way it happens. No, sometimes people die. Yeah. So when people get a stroke, your brain. You guys know how your brain controls your body. You know how it's opposite. So the stuff on the right side of your brain controls the left side of your body. The stuff on your right side, left side controls the right. So when people have a problem on this side of their brain, where do you think they have a problem? On the other side. So they have a problem on their right brain. Their arm gets numb and